Hello friends, I welcome you to Dr. Hemant Antani's Health Talks, and I am Dr. Hemant Antani. What I'm going to do today is, give you a better understanding about the cholesterol, the fats. Actually, that has been going around in the society. It has become a kind of fashion to talk about cholesterol, and you also see a lot of reports coming in your hands of yours or your family or friends, and you exactly don't know what exactly these values are. So let me just talk you about everything that you should know about the cholesterol. This word cholesterol is basically a Greek word, and in fact, the chole is basically bile, and the stereos is solid, and the ol is from alcohol because this is actually a sterol. It's a one kind of a steroid molecule, and that's why the word cholesterol has come. But it was 1769 when the Francois actually was the scientist or doctor who found that there are certain stones in gallbladder which he could not make out what these are because of it, and he said that there is something abnormal happening there. And it was 1815 when Michael Eugene actually was the person who gets the credit of giving this name cholesterol. But whenever you talk about cholesterol, everybody thinks that, well, it's a very dangerous molecule, it's something very bad for the health, it is always going to create problems. Well, let me tell you that without cholesterol, it is impossible to survive. Every cell membrane, the production is only because of the cholesterol. If there was no cholesterol, the cell membrane would never be formed. And if the cells don't form, you can understand what will happen to the human life. And not only that, it is actually a precursor for the synthesis of vitamin D, and then certain steroid hormones and bile acids. So it's very important. All these things are very important for the survival, and that's why cholesterol is very important. Roughly, and the interesting part about cholesterol is that our own body actually synthesizes cholesterol. Every day, the liver, most of the time its liver is synthesizes about 1 gram of cholesterol every day. And 35 gram of the cholesterol is in our body, basically in the form of all kinds of cell membranes, and as I said, there are some of the hormones. And 80% of this production comes from the liver, and rest comes from some of the reproductive organs and adrenal gland. This cholesterol actually is recycled in the body. Like when the liver actually produces cholesterol, it goes into the bile and it goes into the intestine, and part of it is reabsorbed, and it also comes back into the bloodstream and back to the liver. So it's a kind of a recycling which happens. And the 50% of the cholesterol, excess cholesterol, is taken back, is reabsorbed back. And this also has a kind of, cholesterol is managed in a way that, for example, if you're taking very high amount of cholesterol in your diet, the liver will reduce the production, and vice versa. So that's how it is actually, kind of controlled and regulated. Now, whenever you must be seeing in your lipid profile that there are different kinds of figures that you see that's not exactly for the HDL and LDL and VLDL. And many times we find that people are confused what exactly are they. So let me just explain you. Cholesterol on its own is not able to traverse into the blood and go to the different organs and different cells. So they need a vehicle to travel in the blood. And these vehicles are nothing but lipoprotein. Lipoprotein are nothing but protein molecules with lipids, and they become the vehicles for cholesterol to go into different kinds of places. And these lipoproteins are also different kinds of lipoproteins, and every lipoprotein, interestingly, is designated a specific function. So what are they? The first one you must have seen in your lipid profile, which says HDL, which is a high density lipoprotein. Now, high density lipoproteins are considered to be good cholesterol. You must have seen some doctors talking about to make you understand easily that this is a good cholesterol. So HDL cholesterol, what it does, it's a scavenger. So wherever the arteries, wherever the cholesterol is locked or it's accumulated, it actually takes cholesterol from there, takes it to the liver, and liver actually gets rid of that. So it's a scavenger, and that's why it is given that label of a good cholesterol. But the cholesterol which causes catastrophe in everybody's life is LDL cholesterol. This is called as a low density lipoprotein. Now this actually causes the block everywhere that you see, the heart attack, the liver and the paralysis, stroke, the kidney dysfunction, so on and so forth. So this is called as a LDL cholesterol, which is a bad cholesterol. The third one is called as a VLDL, which is a very low density lipoprotein. Now LDL cholesterol actually carries cholesterol with it, but very low density lipoprotein carries triglyceride, which is also one type of fat. So then obviously the next question is, what is triglyceride, or TG as we call it? Friends, triglyceride is also very bad fat. It is actually you get from varieties of the fatty food that you take. And what actually happens with the triglyceride is that whenever we are taking excessive food in our body, and you don't need that many calories, so extra calories are stored in the body in form of triglyceride. So whenever you require more energy, the triglyceride is being used. And that's why this is also a very important fat, because it also causes all kinds of heart attacks and all other problems that you see. At this juncture, it is important for you to know a couple of more things, and they are called as apolipoproteins. Even lipoproteins also have the structural components which are called as apolipoprotein. And apolipoprotein A and B actually are found, and we also have found out the levels because they are actually correlating with how much is the risk that you have. One more thing which I think you should know, and I think perhaps some of you might have heard about this, is we call it as a lipoprotein A, or in a short term it is called as LPA. We don't get it done in every patient, it's not really needed, but this LPA is a low density lipoprotein molecule which is actually also attached to the cholesterol and the part of lipoproteins. Now, why this became very important? Because there were lots of studies which happened, and what happened was that, like for example, Interheart study, which is one of the biggest study that we ever had, epidemiological study in medicine, and lakhs of patients in so many countries were studied, and it was found that those people who had LPA level more than 30 were found to have a very higher incidence of heart attacks as compared to the people. So with this background, let me just tell you that what are the values that you should be looking at whenever the cholesterol report comes in your hand. The cholesterol ideally should be less than 200. LDL cholesterol ideally should be less than 100, but LDL has some points which I'll discuss after a while. Then the HDL cholesterol, which is considered the friendly cholesterol, should be more than 40, because it's a healthy, that's a good cholesterol. The triglyceride should be less than 150. Apolipoprotein A should be less than 120. Apolipoprotein B should be less than 100. And as I said, LPA, which is now actually linked to so many diseases, which is a very bad lipoprotein, which is LPA, must be less than 30. Now coming to LDL, because there are a lot of data which is now available, a lot of studies, as I said before, that many clinical trials and lakhs of patients are being studied, are followed for many years, and it was found that these are the values that you should keep it in mind. And I think you should give attention to this. If you do not have a risk, or if you have very low risk, now you say that how do you decide the risk? There are certain calculators available online, your doctor knows about it, and that is called, most common is a Framingham or ACVD risk calculator. So depending upon your cholesterol level, whether you got associated diabetes, how much is your age, what is your race, whether you are smoking or not, and so all these factors are put into that, and the calculated risk comes. If your risk is less than 5%, it is called as a very low risk. Then even your LDL cholesterol should not go beyond 116, right? Now, if your risk is borderline, that is up to 7.5%, then also the 116 is fine. But if you got an intermediate risk, that means your risk is between 7.5 to 20%, then now we are very strict in our guideline that your LDL cholesterol should be less than 70. And not only that, if you're diabetic and if you don't have any other problem, but if you're diabetic with more than 10 years of duration, that is considered to be what we call as a heart disease equivalent, your LDL cholesterol should be less than 70. Now this is important because you must have seen that in our practice, whenever we give cholesterol medication to the people who got diabetes and their LDL cholesterol is 100, the average person thinks that the LDL cholesterol is very good. No, you need to have it less than 70. And that's why we give cholesterol medications, because all the trials have proven that if your LDL cholesterol is less than 70, then definitely your heart attack chances, your stroke chances, your amputation chances, everything goes down. But if you've got a very high risk, you're more than 20% on the risk calculator. This happens in which kind of patient? A bad diabetic, a person who already had a heart attack, person who already had a stroke, who is a very heavy smoker, who has got a strong family history. So all these factors make the person a very high risk, which is more than 20%. Then imagine what are the values? The values are very strict, less than 55. Yes, your LDL should be less than 55. And all these values have come from different trials. So this is not something which is created out of nowhere. And now it is seen that something called primary prevention. I still remember many people taking aspirin. In fact, today also people are doing that. That if you are more than 45, start taking aspirin, and then it will prevent heart attack. Friends, actually it is statin which is more important for primary prevention. Primary prevention is the one where you have some disease but you have not suffered any event. That means you don't have any heart attack, you have not suffered, and you don't want to suffer. So if you don't want those events to come, and if you make your cholesterol like this, then it is said that your heart attack chances goes down by 25%. So the levels, if you cannot achieve by exercise, diet, and all kinds of discipline that I'll be talking about, then you should take the medications, right? So how would you lower your cholesterol? Obviously, the first thing is diet. You discussed this several times in our previous videos. The saturated fats are very bad. The butters and ghees and sweets and ice creams and chocolates. All these things are bad for you. And then the most important thing which is very bad is trans fats. And trans fats are the one which are in processed food, canned food, and I think fast food. Trans fats are the worst fats to have as far as the health part is concerned. So your question would be then, are there any healthy foods, healthy fats? Yes, there are. For example, all the nuts have got fats which are healthy. If you've got omega-3 fatty acid is a healthy fat. Soya bean, sunflower has got a healthy fat. But you have to eat more of vegetables, nuts and legumes, and less of this. Having said that, I also understand that you just can't cut it off totally, but the golden rule that you should remember for your good health is that all total calories that you are taking in your body, less than 30% should come from your fats. It's very important. Now, some of the things which you should remember, many times you will find that the labeled food that you take, or canned food, eat somewhere, or say many food items, they say that it's a zero cholesterol food. Friends, try to be aware, because this is a trick. Cholesterol, no, it's very important that look down and see whether they've got any saturated fats or they've got any trans fats in that, and they will be there for sure. And if they are not written trans fat, what is the other name for trans fat? Is hydrogenated oils. So if there is something called hydrogenated oil, that also is in fact worse than cholesterol. So I think this is something which you should always remember in mind whenever you see the label. I think weight is very important, and physical activity. If you don't walk, if you don't run, if you don't bicycle, if you can't do any kind of thing which really makes you move, then you are going to have more cholesterol, and your risk of getting all these diseases would be high. And we already explained it, and you know it better because that has been stressed again and again. Smoking has a direct relationship, because smoking causes decrease in friendly cholesterol, which is HDL cholesterol, making you vulnerable to getting heart attacks and strokes. And I think stress also has got a direct relationship to your cholesterol. There are certain risks which are beyond your control. For example, post-menopausal women, their risk becomes a little bit more because the estrogens actually protect them. Some patients are born with the genes of carrying cholesterol, so that's not something in your hand. But what is in your hand is to make sure that your lifestyle improves and you can bring them down. Maybe they also do to take medicine in a little higher dose because they've got a familial, what we call the dyslipidemia. And certain race, for example, African American race is known to be having high HDL levels. So these are something which is not in your hands. In a very nutshell, I'll tell you that if you cannot achieve the cholesterol LDL levels which we discussed a few minutes back, and what kind of disease, what kind of risk you have, and what kind of levels you should have. If you're not able to achieve that with your diet or lifestyle modification, you have to go to the drugs. And now medications are available. Statins, everybody knows about it. Rosuvastatin, atorvastatin are the commonest one which are used in India. There are many other statins which are available. How do statins work? There is something called as the HMG-CoA reductase enzyme, which is in the liver, which produces liver, and the statins actually are the inhibitors of this particular enzyme. So the cholesterol synthesis by liver is hampered. The two main side effects that you have to keep in mind, it is 2 to 3% people with the statin cannot tolerate because they get severe body ache. Very, very rarely they develop what we call as a rectomyolysis, so your CPK level in the blood goes up. And the liver dysfunction, of course, it is not as much as it was perceived to be, but to be on a safe side, as a scientific thing, before you start statin, you should make sure that your SGPT liver function is normal. And at least once when you take the statin, after a month, you should get your liver function done to make sure that your liver is fine. But statins have done wonders in terms of all the trial outcome data that we have. But statins are very weak as far as the triglyceride is concerned. And for triglyceride, there are two molecules. One, of course, was fibrate. The second one, for which we should be proud, because India has given this molecule to the world, which is saroglitazar, which is also found to be lowering the triglyceride. Another drug, which is called ezetimibe, it actually reduces the reabsorption of cholesterol from the intestine, and that's how actually reduces the cholesterol level. But then, as I said, that people, all the doctors, all the trials showed that people who had a very high risk, for example, a patient who had a heart attack which was very bad, now we are very clear that their LDL level should be less than 55. Now the statins are not able to actually bring down this level, and that's why people were in hunt of a new molecule, and now the new molecule has been found out. This is only for your knowledge, you should know this, which is called as a PCSK9 inhibitor, which has alirocumab and evolocumab. These are the names. These are not available in India. In USA it is available, but by US standards also it's an extremely expensive agent. And second thing is, it is to be given injectable, maybe once a month or once a week, depending upon the molecule that you have. So this is not in a common use right now, and it's not really needed for all. But then you should remember that these kind of drugs are at least available. So friends, I'm sure you must have understood and the importance of cholesterol in your body. It's not bad that every time, but it's very important that you develop the awareness towards what you're eating, how you are living. And if you are careful about all the things that I discussed, I can assure you that your life would be very healthy. Ultimately, the key to a good health is only in your hands. Thank you very much for your patient listening.